This video will be going through the types of provider networks, and hopefully you can get a better understanding of what rules your provider network or your health insurance plan wants you to kind of follow. And so on the agenda, we have the most common network plans, and so I'll go through those, as well as how to locate what your plan type is and how to ensure if a provider is in your network. So what is a provider network? It is the facilities, providers, and suppliers that your health insurer or plan has contracted with in order to provide those services to you. These are the four common health networks, healthcare networks, and so in the following slides, when I go through each one, I will explain a few categories of information, which includes how the rules in which you should be following when seeking care, if it's supposed to be in network, if you can go out of network, as well as whether or not a primary care physician or if a referral is required by your health network. And so the first one, health maintenance organization, will, and all of these that I will talk about will cover you when you stay in network, and so that's shown here. If you go out of network, it's usually not covered. You may have to pay the full price, and you may or may not be covered if it's an emergency, but that is up to circumstances and your health insurance plan. Here, a primary care physician and a referral are required for you to be able to utilize this plan. And so with a primary care physician, this is someone who will manage all of your health conditions generally, and if they see that you need to see a specialist, they will refer you to one. Generally, you will have to live or work in a service area for you to qualify for this plan. And if you have any specific questions, always give them a call and just make sure you have the most up-to-date information. Next, a preferred provider organization may or may not cover you if you go out of network, and if they do, it may be at a higher cost than you usually would if you were to go in network. However, neither a primary care physician nor a referral to see a specialist is required. For a point of service plan, you will not be covered when you go out of network, so again, you may have to pay that full price. A primary care physician is not required for you to have initially to see, someone if you have questions or specific needs. And however, a referral may or may not be required, and of course, you always want to go ahead and call that insurance plan if you have any specific questions. I have here that it's kind of a mix between an HMO and a PPO. And it's similar to a health maintenance organization in that the out-of-network guidelines are a little bit more strict, and your health insurance plan will not assist you, if you go out of network in a non-emergency situation. And it's similar to a preferred provider organization in that you don't need to see a primary care physician. What is an exclusive provider organization? This is the last one in my presentation, and so here similarly to the last one, you may not be covered. You usually will not be covered if you go out of network. Again, you may have to pay that full price. However, your insurance plan can help you if it is an emergency. Neither primary care physician or referral is required for you to be using this plan. And next is just a comparison of the four different plans that I've mentioned in these categories, and the check marks mean that the leftmost column applies to that plan, and an X means that it does not. And this is just an easier way for you, hopefully, to digest this information and just kind of to get a better understanding between the different plans that are available. And so I hope you, at this point, are able to identify what plan you have on your insurance card or in your portal, and get a better idea of how you would be able to utilize your insurance. And so next, I have a video provided by the Kaiser Family Foundation, and this is going to explain the different types of provider networks and just a different way to give you this information.
This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. In some plans like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Sound easy enough? Well, sometimes staying in network can be tricky. In a hospital, it's possible that your surgeon could be in network while your anesthesiologist is not. If this happens to you, don't be afraid to negotiate with your provider or file an appeal with your insurer.
So hopefully that video was able to help explain in a more visual way how these plans play out. And here next, I'll go over where you should be able to go to find what plan type you have. So again, it may be listed on your insurance card. You can go to your online insurance portal once you've created an account and search it up there. You could always call your insurance company's phone number, and they'll usually ask for your name, date of birth, and your member ID number. And that way you can ask any questions you have with them about your plan. So how to find out who is in your network. For example, provider or hospital or an urgent care facility, and usually here you'll want to just go into your online insurance portal or call your insurance company's phone number. Usually your insurance card won't explain who specifically is in your network, but you can always go to your insurance card if you if you want to see your insurance, find your insurance company's phone number if you don't have it saved to your phone. And so so that's what you want to do. And so what this video went through was the most common type of network plans, and explained that some are more strict about who you can or can't see, whether they're in or out of your network, and how much assistance you would get by them if you did go out of network. And I also went through if a PCP or a referral to see a specialist is required. And always the best thing I can recommend is for you to give a call to your insurance, hopefully within business hours, to ask them any specific questions you have if you're having trouble either finding that information or if it's still a bit difficult to understand. So yeah, thank you. I hope that helped explain plan networks.